Well, hello everybody. My name's Tony Hunter. I'm a social worker and now Chief Executive here at the Social Care Institute for Excellence, and welcome. There are 82 of you out there already, so that's really great. So thanks for joining us on this webinar about transitions to adulthood. And it's great to have with us Irina Pona and Sarah Hegarty from Children's Society. They'll introduce themselves in a minute. A few introductory remarks from myself. I don't need to tell you about fire alarms or anything or where the toilets are, do I? Because you're not here. But I don't know. I don't know what the weather's like there. It's pretty grim. It's pretty grim here. But that doesn't matter, does it? It's great to have you with us. Those of you who've been, some of you will have been in a webinar before, some not. This is going to be wanted to be really highly interactive. We've got some great material here from Irina and Sarah. That's going to stimulate all sorts of conversations between yourselves as well. Some of you will make connections between yourselves on local initiatives. You may want to follow up with yourselves later, and that's fantastic. Roughly in running order, in a minute I'm going to introduce Irina, who's going to kick us off by giving us a bit of a presentation from the Children's Society. You will see those slides. We're going to send those slides to you afterwards as well, along with a recording, along with a copy of this recording, which is a pity really, because you're going to hear this twice, but there you go. We've also got James here, with a big smile and a wave, which hello. You can't see. He's saying hello. Thank you, James, who's our technical expert, so that's great. This will go on for a maximum an hour. Somebody will be eating sandwiches and bobbing in and out perhaps as well, but you know, we're looking forward for a very interesting 50-55 minutes or so. Don't hesitate, get stuck in, ask questions, make comments, make connections with each other. I don't think I've forgotten anything. Have I there, James, do you think?
No, that's all good.
Okay, that's a thumbs up from James, and that's who your presenters are today. That second slider, that's me in the middle. I'm much better looking in real life, I assure you. And so I'm going to hand over to, well, Irina and Sarah, just introduce yourselves first, then we'll go into presentation. Irina.
Thank you, Tony. Good afternoon, everyone. I'm Irina Pona. I'm Policy and Research Manager at the Children's Society. So at the Children's Society, I lead on our policy and research work that focuses on young people at risk.
Hiya, I'm Sarah Hegarty. I'm one of the operational managers at the Children's Society who work within our London hub, overseeing some of our direct services that support young people who face multiple vulnerabilities.
Okay, so Irina, let's kick us off, yeah?
Excellent. I have to say this is my first webinar, so you have to bear with me if I do something wrong. But hopefully, oh,
it was fine in rehearsal.
It's
everybody.
Already, yeah. So that's me. Why is it not clicking? Oh, this one. Sorry. So before I start on my presentation, I wanted to say a couple of words about the Children's Society. The Children's Society is a voluntary sector organization with over 140 years history of supporting some of the most vulnerable children and young people in our country, and you can see this is from our archives, and you can read actually about lives of children we supported on our archives. But currently the Children's Society specifically focuses on supporting vulnerable adolescents. We work with those who experience child sexual exploitation, child criminal exploitation, children going missing from home and care, and also young people with mental health needs. We also undertake research, and through our policy and campaigning work, we are advocating for changes to national legislation and guidance to improve lives for all children in this country. In improved protection and support for vulnerable adolescents, those aged 16 and 17, as they transition to adulthood, has been something we focused our work in the recent years. And in the last 4 years, we've been running a campaign called Seriously Awkward, which specifically focused on 16 and 17 and how they transition to adulthood. During that time, we produced a number of different research reports, so you can see them on your screens. All of these reports are, we will be talking about issues that we focus on in those reports. They zoomed at specific aspects of their lives, like homelessness, child sexual exploitation. So you can access them on our website at any time. So today, Sarah and I are going to talk specifically. We want to discuss with you why we believe 16, 17-year-olds are vulnerable and require support as they transition to adulthood. We'll share with you some about learning from our research and practice about how poor transitions lead to poor outcomes into early adulthood, and also learning about how transitions work in practice. So first, why we believe that 16 and 17-year-olds need to be better supported as they transition. First argument is that 16 and 17-year-olds are not offered the same protections as younger children in legislation. I would say from legislation point of view, 16 and 17 years old it's quite confusing for professionals. In law, there's a clear line between when childhood ends and adulthood begins. It's at the age of 18, according to the Children Act and the United Nations Convention on the Rights of the Child. But is it really always that clear? Are 16 and 17-year-olds always seen and treated as children? We wanted to start with a small quiz for all of you, a fun one, which James, we will need your help with. To test your knowledge of at what age do you think young people are, can participate in different activities. So the first question is, at what age do you think young people can buy cigarettes or alcohol or access benefits, same as adults? Perfect. So we can have, I'm not going to reveal the answers until we have all our questions done. We only have 3 questions, so it's not a very long quiz. Our second question is, at what age can young people get married, join the army, and then stop being protected by child cruelty law and child abduction law? And our third question is, at what age do you think young people can drive a car, give blood, or apply for a private pilot's license? It's a bit random, but... I have to say, you're all very good, because for all these 3 questions, majority of you responded correctly. So the first one about cigarettes, alcohol, you have, it was the age of 18. The second one about getting married, joining the army, and child cruelty law is the age of 16. And the third one is the age of 17. And so you can see that the age of childhood is not consistently recognized in legislation, and in some cases it's perfectly fine, because at that age young people are required to develop independent skills, and it makes sense. But in other cases, like in relation to child cruelty law or child abduction law, which allows police and safeguarding professionals to intervene when someone is coercing a young person and encourages them to run away, this can be have a detrimental impact on how professionals can safeguard young people, and also it may send wrong signal to professionals that 16, 17 years old are no longer vulnerable and no longer children. So thank you for participating in this quiz. It was really good to have all you taking part. So the second reason why we believe 16 and 17-year-olds are vulnerable is because of their developmental needs. 16 and 17 is an awkward age. It's a period of transition for childhood to adulthood, a period of physical and neurological development, when young people develop greater independence, develop new circles of friendships. And we know now from recently published studies into brain development that parts of the brain, particularly those responsible for emotional regulation, continue to mature into early 20s, and that adulthood doesn't arrive as young people turn 18, which means that young people at that age are not yet making decisions in the same way as adults. And also, we know that young people who experience neglect and abuse during their earlier childhood, they may particularly struggle at that period of time. And data and research confirms that. We did some research using data from Understanding Society survey. Understanding Society is a national survey which questions asked of people of all different ages. So we focus specifically on 16 and 17. And we picked up a number of different factors in young people's life which may make them more vulnerable. So we focused on such factors in their life as life satisfaction, material deprivation, relationships with family, mental health, etc. And what we found out was that actually majority of 16, 17-year-olds, if you can see that graph on the right-hand side, have some level of vulnerability factors present in their lives. The small number don't have any vulnerabilities present, but others reported that they have, 51 reported that they have factors related to poverty and material deprivation present in their lives, 46 in relation to physical and mental health, 29% familial and social support factors, 18% in relation factors related to risk-taking behavior. But 1 in 5 young people have at least 5 vulnerabilities or more that span several different aspects of their life. So there's quite a lot of young people and vulnerability at that age. And of course, many young people will not require any intervention because they will have loving and supporting families or friends on whom they rely for support and guidance. But for some young people, these needs are, for example, those whose needs are greater than their families can support them with, or those who do not have supportive families. They will rely on help from statutory services such as children's services, mental health services, housing. In many cases, they may come to attention of services through being engaged in some criminal, so through referrals from police, for example. So if you look at the statistics from Children in Need statistics, that is data that's regularly published by the Department for Education, we know that we look specifically at factors identified in assessments of children in need who are 16 and 17. And you can see that top factors identified in assessments of this age group relate to child's mental health, parental mental health, domestic violence, social and acceptable behavior, emotional abuse, and child's drug use. These are the top 6 factors identified in assessments of children in need, those who are vulnerable and referred to services. But also,
Irene, I've just seen that question from Rosemary there about the previous slide, about what year, because there's 2012, 2013 and there's what's...
it's 2014 and 2015. And
okay, so it's 2 years later.
Yeah, so the Understanding Society survey, they do them in waves. So we compared across 2 ways where the data was available, and it actually the level of vulnerability is, so these are 2 different groups of 16, 17, and the level of vulnerability is very similar. There's now data available for the next wave after that, so we will be, we haven't yet analysed it and released, but we will be comparing them later. So that will be on our website at some point.
Yeah, thanks. And thanks for the question, Rosemary. Rest of you, yeah, just keep comments and questions coming in. We're keen to respond to what we're hearing. And Lynn has sound, yes, with 5 exclamation marks.
Really
You seem pleased, Lynn.
Yeah, so going back to data from about children in need, those referred to children's services. So we can see top factors, but we also looked at are issues that identified in assessments of vulnerable 16-17 referred to services different for those aged 16-17 and those under the age of 16. And what we found that there is a difference, that children who are 16-17 have more issues in their lives that are about them and their lives rather than issues in families. So you can see that they are more likely to have something like report self-harm, or these issues are more likely to be identified: self-harm, going missing, mental health, drug use by the child, child sexual exploitation. So all of these factors are more about experiences outside the family rather than within the family unit. And the third issue that why we believe that they need to be better transitioned is that only a small number of vulnerable 16-17 are entitled to support post-18, but that's something that Sarah will talk about later. Before we go on to...
Irina, I'll just stop for a second. Any kind of surprises in what Irina said there, really? I mean, by far the majority of you got the answers to the 16, 17, 18 questions right, which is great, really. But any kind of surprises so far in what Irina's been saying? I mean, I heard what you're saying, Irina, that some of these experiences, they tend to be outside the family rather than inside the family, for example, I think, which isn't intuitively what I'd have imagined, to be honest, really, but I don't know what others think. Dawn, what's that you were saying, that you worked with year 10 and 11 for 12 years in school, and totally agree, okay. Issues with VATS and support was really hard to get as they were near 16. Really does feel as a kind of a cliff edge, doesn't it, really, in some ways? Yeah, Irina's nodding away here. Mary, it fits your expectations. Okay, yeah, let's go on with the poll then, Irina.
So so we have another poll. This time we want to find out a little bit more about what do you see in terms of planning for transitions for different groups of children in the areas where you are. So I have 4 questions. They are all very similar, just about different groups of young people, and there's a scale, so I will ask you to vote on a scale. So the first question, James, if you can help me with. So the first question is, in your area, how well are transitions planned for children in need? So children on child in need plan and children on child protection plan.
Wow.
So the scale is 0 to 5, and 0 is like almost nothing, and 5 is it works really well. Okay, our next question is the same question, but this time the question is about looked after children. So in your area, how well are transitions planned for looked after children? Again, same scale. The third question is, again, same question, but in your area, how well are transitions planned for disabled children? And the last question is about, in your area, how well are transitions planned for young carers? I will explain later why we're asking specifically about those groups of young people.
Okay, and any kind of surprises there, Irina, Sarah, would you say, in those responses? A lot gathering around the middle there. I think there were more, if I saw it right, there were more, for children inside the looked after system, seemed the perceptions that they are better equipped, better supported than the other groups that we looked at, but not hugely.
Not huge differences. Yeah, which is. I don't think there's nothing surprising. It's probably what we expected. It's good at least to see that in relation to all groups there's some transition planning, because there's more answers on kind of scale 3, 4, and even some 5, which is really excellent to see.
Yeah, very good.
Right, and there's that comment from Rosemary there that people better supported if they're kind of, I've lost it now, if they meet Care Act criteria. So there's something about if you're inside the system, really, isn't there? The legal responsibilities are kind of there, really, which applies to children in the care system as well, than if you're kind of perhaps sitting slightly outside, or perhaps less likely to be picked up, I don't know.
I think we will pick up that issue a little bit later in Sarah's presentation, Sarah's bit. Yeah.
Oh, it's me.
Thank you very much for taking part in this, Paul.
Okay, thanks everybody. So briefly from me, a bit of a plug for the Preparing for Adult, the Role of Social Workers material that's on the SCIE website. Commissioned by the Office of the Chief Social Worker for Adults, and there's Lynn Romeo, the Principal Social Worker for Adults, at the bottom left there. And some of the key messages from there really are, that's Lynn's, let me get onto this, here we go. I think Lynn's quote there, the challenge is move away from the idea of systems, that children supported by children's social care just need a process to transition to support and arrangements from adult social care to achieve the best possible adult. I think she's saying it's kind of not as simple as that really, and if we move on, I'm going to skip through some of these slides, but again you'll get the lot afterwards. I'm going to move on to the right, to the last 2 slides actually. The values, skills and attributes that are solid grounding in social care law, practice and theories is central to good social work, that we really need to understand that that baseline for young people with learning disabilities. But more important still, as always, in social work is that set of attributes and values that help us really focus on people as individuals. And actually, that's the message from the final slide there from me, which is about focusing always on the person. Yes, we've got the legal frameworks and our own processes and systems and procedures inside our own working environments, but ultimately, we must never forget this is actually about people and the families they support. And transitions can be notoriously difficult for young people and families to navigate. We may be dealing with this all day, every day, some people, but it can be bewildering, and I know a lot of people feel this has been very difficult indeed and have certainly got lost. So, okay, I'm just looking up and down the comments. James has given a link to the guidance on the SCIE website there. Again, we're grateful to the Department of Health and Social Care for commissioning that piece of work. Shouldn't it be social care staff that includes all professionals such as OT? I think that's a good point, Tanya. Thank you for that. This is not just about social workers. In fact, people working together collaboratively across professions has to be critical. Okay, so I am now going to hand over to Sarah.
Excellent, thank you. So just going to pick back up really with some of the data that Irina was showing us earlier. As kind of Irina's pointed out, there is a number of young people that even though they may have had some vulnerabilities during the ages of 16 and 17. They will transition to adulthood, and those vulnerabilities will reduce, but the research does kind of suggest that for a larger proportion, those vulnerabilities will kind of persist or intensify during the transition period. So our analysis of Understanding Society survey, which Irina touched on earlier, showed that those who had more vulnerabilities when they were 16 and 17 continued to experience vulnerability factors in their lives as 19 and 20-year-olds. Those who experienced low satisfaction with life, poor health, were not supported by family, had caring responsibilities, and those with high levels of drug use at the age of 16, 17 had high levels of vulnerability at the ages of 19 and 20. And being not in education, employment or training at the age of 19 and 20 is also associated with higher number of vulnerability factors at the age of 16 and 17. What I found quite interesting actually out of this data was data which was from a small number of local authorities also showed that young adults claiming benefits and those seeking help because of homelessness often had previously been known to services as child in need. So that's quite interesting. So kind of the next slide is kind of taking us back to the poll that we just did. The evidence for improved transitions to adulthood for vulnerable 16 and 17-year-olds is, in our view, and the view of other organisations who work with vulnerable adolescents, quite clear. These are the groups of young people currently defined in legislation or guidance as the groups in relation to who local authorities either require to plan for transition or provide services post-18. So as you can see from that slide, kind of the level of detail about that transition really varies, including kind of the child in need, could be quite vague. So in practice, we really know that depending on how the child is known to children's services, so for example, a child in need or a looked after child, their experience of transitions can be really different. So I just suppose I wanted to pause really and have a little look at that child in need statement. We're obviously really pleased that we have actually got that statement around transitions included in the Working Together guidance. However, it's really down to the social worker and the professional network supporting that child to translate that statement for the child and kind of come up with a plan for that child's transition. So,
Sarah, it's really interesting though, because a point from Matt was worrying that the continuity therefore was so important. Social work turnover was leaving people without developed sort of adult placement plan. Because as you say, that must be really important. Louise, I've noticed you're from Parent Carer Forum, and it makes me wonder: do others have Parent Carer Forums? And maybe that's a connection some of you can make between each other. That's working on planning for adulthood, and the parent perspectives must be so important, I guess, Sarah. Yeah.
Absolutely, yeah, absolutely. Kind of going back on Matt's point there, I'm going to talk in a little bit about kind of what we see on the ground and what some of the voices of the young people that we support, and actually, kind of that not consistent support from kind of a consistent worker can really impact on that transition and the plans around that child. So as I was saying, just kind of reflecting on that children in need statement and thinking about kind of we could all interpret that quite different. So just thinking about in kind of your practice, how you might interpret that for a child. And to give kind of example on that, these are two kind of different, these are real life case examples of two young people with very similar needs who were but very different transitions and support post-18 due to the differences in their status with children's services. So you can see Dorothy was in child in need and Lucas was a looked after child. That's why that through 16 and 17 professionals working with vulnerable 16 and 17-year-olds, one, we must put in place plans to address issues that young people may experience, and two, we must ensure that they liaise with relevant adult services to ensure that some support is needed or available post-18. So you can see Dorothy's journey is looking very different to Lucas's journey, even though they kind of experience the same kind of issues throughout their childhoods.
So I just wanted to change slide. I've noticed that Parent Carer Forums, that people have come forward saying, they're also there in Wigan, in Calderdale, in Suffolk, and in North East Lincolnshire, where I used to work. So hello Marie. Okay, so that's good. Sarah, back to you. Yeah.
Excellent. So these are some of the kind of areas that we typically see in practice, the needs to address issues from the point of view of transitions. What I really wanted to do really was focus on this slide in a little bit more detail. So often what we see in practice is that there are multiple areas that have not been addressed in preparation for transitions. And just when I was thinking about this slide, I just kind of reflected on what we kind of see in our services and what kind of young people tell us. And I suppose what we see is that kind of pathway plans or plans for transitions are not at times reflective of the needs of that child. So their specific needs and vulnerabilities, including maybe some of the kind of contextual risks that child faces as well. Often young people are really not aware of kind of things like their pathway plans or what their plans are to adulthood. And this kind of feeds into maybe some kind of lack of communication about what is expected for the child. And therefore we see that some young people might not meet the plan that's designed for them. So I'll give you an example of that, which we see quite frequently within our kind of casework is around young people not kind of meeting their independent living skills kind of assessments. And when we take that right back with the child in terms of saying, like, did you know what was kind of expected of you? What does this mean? It is sometimes really not clear to that child. And obviously, as you all know, that can have quite a detrimental impact on the child and not being nominated for like housing, etc. We often see like a lack of support to achieve the plan. So there might be a kind of good plan in place, but actually kind of the lack of support to achieve that plan has been quite evident. We often, like young people, talk to us about quite unhelpful language that's sometimes used. So things like, you're not going to get this support when you turn 18. Come on, you're an adult now. If you don't turn up, we're not going to, keep offering you an appointment. And I suppose we really understand that actually sometimes you're trying to prepare. Professionals are trying to prepare that child to maybe understand the differences between children's services and adult services. But as we know, it's like a really scary time for that child. So sometimes young people have talked to us about that being quite unhelpful for them. Another kind of point I wanted to make is we work with a lot of young people in custody settings that might be in like youth offending custody settings and might transition to adult custody settings. What we really see in practice is how much that young people within the criminal justice systems, their transitions are even less planned and even less communicated and even more scary because that child is about to enter an adult custody setting and that's really daunting. So that's one area that we've really highlighted in our practice. Another point I suppose I wanted just to pick up on is kind of that non-engagement and how often, like when we're asking what's going on for that child, we will be told that the child is disengaged or it's due to non-engagement that service is closed. I suppose one of the things that we kind of see here is about the non-engagement can feed into all the points that I've just talked about like lack of communication, a lack of understanding, the lack of support. But yeah, often kind of maybe that's seen as the child's fault for not engaging. And when I was thinking about this, I thought about kind of relating it to maybe our own experiences of kind of change and how difficult that is. And like even if we took it to a really simple kind of experience of like a change in a workplace, like a restructure or being made to go into a new team or like them merging teams, and how difficult that can be for us as adults, and how if we don't get the communication about the plans, how we're not kind of supported with that change, how we're not given a little bit of empathy, maybe to have a bit of a moan and say, I don't know if I like this, like, etc. And how like unhelpful language such as like things like, come on Sarah, change is a positive thing, and how that kind of stuff can help us feel like disengaged from maybe the place of work or feel a bit annoyed at the place of work. So yeah, when I was thinking about this, I was thinking about what it is that we as adults would expect during a period of change and transition, and how the same principles really apply for the children that we support.
I was reading some of the comments, and it's I think really interesting to see how many of you comment that you have transition teams in place. It's really positive. I think it explains to an extent those poll results before, where you've seen more on 4 or 5 scale that transitions are happening. So it's really good. But obviously, we know from someone earlier also commented on how local authorities are not aware of all the needs of children, young people who may need that support, and not aware of all the numbers. And I think it's particularly true with children in need, because local authorities currently are not required to monitor any progress for these children in need. So in most cases, we just don't even know the outcomes for them and what they need. So it's very difficult to plan those services unless, as we can see from comments, in areas where they do have good transition teams, where children's part of social care talks well to adult part of social care. So it's really excellent to see those examples that you mention in your comments.
It reduces the chances, doesn't it, of people kind of dropping out of the system, as it were, really.
Falling through the cracks.
Falling through the cracks. We had that poll result earlier, which sort of made it kind of more clear that if you're a child in the care system, then perhaps you're a little bit more likely to get some support. We had a comment, I can't see it now, but from Lynn earlier, who's a foster carer, who talked about a 21-year-old young lady with a child who wants a case closed kind of outside the system, so kind of all falls away. And Sarah, liked your reminder about how difficult change is for us as adults.
Absolutely.
You know, and as workers in a fairly safe environment, really. Just imagine what this must feel like.
Yeah, absolutely. I mean, young people talk to us about it being a really scary period of time. And as you all know, that actually, like, fear and anxiety can come out in so many different ways. And I think sometimes we can misinterpret, or sometimes professionals can misinterpret that kind of fear of transition as like, non-engagement or just, difficult young person. And I really liked Pauline's point about disengagement should be turned on its head.
Yes.
And I totally agree. I think that if a child is disengaging, it's because we haven't made that plan effective for them, or we've not got the right services or support in place for them. So I really agreed with that point. Really agreed. Yeah.
And there's a question from Janine there. Was it an all-age disability service? Do others have this, and has it actually helped with transition to keep that focus on the person as they move through ages? What are others' experiences on that? Okay.
Brilliant. So just kind of moving on to kind of the NICE guidelines really around transition. So obviously you will be aware of the NICE guidelines. That's the National Institute for Health and Social Care Excellence, and it provides like the national guidance and advice to improve health and social care. Now, when we looked at these, it was quite eye-opening for me really when I looked at these in terms of my experience of supporting young people. And when I saw a comment earlier about kind of plans start too late, and this slide really reflects that really, because it suggests and recommends that kind of planning for transitions with health and social care practitioners by school year 9, so age 13 to 14 years, or immediately if they enter children's services after school year 9. And I think that first point really is quite eye-opening for me when I think about the young people that we support who are 17 and do not have any kind of robust plans in place. But yeah, I think that's an interesting slide to kind of reflect on in terms of thinking about your own areas and kind of the practice that you see. And I suppose kind of the last slide, or one of the last slides that we wanted to look at is a serious case review that took place in Newcastle. Now this was specifically around kind of exploitation and transition for young people going from children's services to adult services who were experiencing exploitation and trafficking. And Newcastle looked at this under a serious case review. And I just think some of the points raised within that serious case review around recommendations was actually reflect some of your comments, but would be really interesting to consider. And I know this is kind of reliant on your kind of local authority you work with and kind of thresholds, but that serious case review pulled out that young people should kind of be treated as victims up to the age of 25, and that was specifically around those who have been exploited and trafficked. But we often, see a real change in people's views on victims at the point of 16, 17. They talked about things like kind of joint planning in cases between children and adult services, co-location of children and adult services. So I know a lot of local authorities have moved towards that model. It'd be interesting to see if you have that in your local area. But what really stood out as well for me is that young people spoke about their concerns around transition, especially around CAMS to adult mental health services, and how they didn't feel supported to adult mental health services. So yeah, the links there to look at the serious case review, but some really interesting themes come through it.
I think looking at some of the comments, it's quite interesting that some of you commenting that transition happened at particular age, so 18, 15 was mentioned. I think it's really important to remember that transition should not happen at particular time, because transition is a process, and how it's planned and how it's happening, it should be gradual and building skills and checking constantly that things are progressing. So when it happens at a particular time, and we know from our services for many young people it's 18, it's that cliff edge situation where everything, and we know that children's services and adult services, they do have slightly different culture and different approaches to how they support children and adults. And I think there's something about this transition period where they need to work together to accommodate both sides of childhood and that early adulthood.
Yeah, just picking up on that about criminal and sexual exploitation and transitions to adult services, absolutely agree with that comment. We have young people that are, have big plans wrapped around them, like big kind of disruption plans and kind of safety plans wrapped around them up to the age of 18, but their exploitation doesn't end at 18. And what we often do is kind of push for the local authority kind of exploitation teams or MACE panels to consider that child to be like further supported beyond 18, kind of with the same level of support, but it's a challenging one. But I really agree with that point.
I think we also did at some point survey of social workers, and one issue that was raised that adult services are not so much focused on safeguarding, they're more focused on supporting the needs rather than safeguarding. Obviously with vulnerabilities that we are talking about here, like criminal exploitation, sexual exploitation, those vulnerabilities and contextual safeguarding issues, safeguarding needs persist into adulthood, and I think there's something that needs to be done around how adult services are able to pick up and safeguard vulnerable young adults.
So we wanted just to kind of end on a quote for a young person, really, which you can all read. But it's just really important that we see and support children according to their needs and not their age, and listen to them. And I think the point where they talked about being palmed off at 18 really reflects many of young people's transitions periods that they face.
Okay, so there's our presentations finished. There's been a lot of you, some of you have been making connections with each other, asking each other questions about how systems operate in your area. So let's keep that coming. But in the meantime, I think that powerful starting point of that last slide. So we are still kids, and again, it's well worth remembering what this must actually feel like. Okay, so. What Steve's saying, my London Borough might have a transitions team, but as my son turns 18 in January, they've never contacted us. Okay, so, there's still lots of ways in which people can kind of fall through the cracks. And I forget who it was. I think it was you, Marie, making a comment earlier about the importance of starting planning early. If it's done late, maybe that increases the chance of people falling through cracks when people are very busy and so on.
Like Tanya's comment at the end, we need to talk about support. I completely agree. This doesn't always have to be commission services. It can be from whatever services are already available or community support, but it's how do we plan for what young person or young adult actually needs to enable them to become independent and reach their potential. And very often when we campaign for change, that's one of the arguments that is put against support, because it's seen as kind of giving everyone the same entitlements, and I don't think that's what we mean by that. What we mean is just recognition that if someone is vulnerable, they remain vulnerable, and we need to give them support to make them more resilient and able to live their lives to the to the best they can.
Okay, so have what was that? What's this? Goes down the screen.
There's some questions about is there value-evaluated service in any local authorities? I know that the innovation program run by the DFE, where they funded some transition services, they publish a number of different evaluations, so it may be helpful to check the innovation program on the Department for Education website for those who have been evaluated.
Right, there's an interesting point by Lorraine there, really, that people's needs sometimes being perhaps inflated to get them through onto adult support criteria, I guess, really, and the implications of that. And the risk is then the services kind of pour in as perhaps they're seen as needing to do, but that actually can obstruct a person's capacity to learn to be independent. So that's an interesting one from you there, Lorraine. And there's a question there from you, Anne, about evaluation. Yeah, what do we know about the evaluation of different forms of service arrangements? And maybe some of you can share that as well.
I also think on the independence side, particularly with disabled young people, those with learning difficulties, it's learning more from some of our practice, so it's more anecdotal, but sometimes families feel very protective of their young people, and they may not be happy for them to develop certain independent skills like traveling on public transport, etc. So I think transitions is again that opportunity to work with families as well as with young people, and it's true about other young people as well, because where we have those risks that come from outside families, family is usually a protective factor, so services need to remember to include families in those transitions planning to enable young person to stay safe and have that protection from their families as well.
Great, thank you for that, Irina, as well. And there's Tanya's question there: is there a known benchmark transition service anyway? I wouldn't expect you to come off the fence and say it's great in this area. Is there any comments that you want to make about what really, if you would have to summarise what a really good transition service looks like? Don't want to put you on the spot, but what would you say?
So I was thinking about some of the things I suppose that had worked well for some of the young people that we'd supported, and where we saw good kind of transitions. And some of it's really simple things, like really good communication with that child, a real link to those services, whatever those services are that child might need. So I've seen the child's kind of adult service professionals, meet them prior to that transition, to be coming to their meetings, to kind of build that relationship with that child before they start accessing those services. And that's been great, because that's meant that child has been able to turn up for their mental health appointment and know who they're seeing, or turn up for their probation appointment and know who they're seeing. So kind of those kind of building on those relationships, communication around what's happening, and kind of acknowledging that change, it's a difficult process, but we're going to support you alongside it. So some really kind of simple things that I've seen.
I would also add consistency. So when we do research, and we often do research with young people, we talk to them about what positive means to them, and that consistency of professionals, consistency of relationships is something that comes through strongly every time, so that they don't have to tell their stories to new practitioner every time, but someone who understands them and that doesn't judge them. This is particularly, we are talking about young people who, you know, may have other risks like child sexual exploitation, child criminal exploitation. So they would understand, not judge, and try to listen and work with them around what that young person wants to achieve, rather than telling them, right, so we want to get you into education and that's the college and you have to go. Well, for that young person at that period of time in their lives, their priority may be how to get housing or become more financially independent. So that's another important.
Okay, so there's, and I think that person-centred service is was one of Lynn Romeo, the principal social worker's key points as well. Well, I think we'll finish on that high. It's been great to have this webinar with you all. It's been great. We've just dipped to 99, but actually throughout this there's been around about 100 people involved. So we hope this has been useful for you. You've clearly made connections between yourselves as well. So for me, Tony, a big thank you to Irina and Sarah from the Children's Society, and to the invisible or unheard James, who's been prompting us as we go. And most of all to yourselves for your obvious interest, the range of experiences and systems that operate in your places, that some of you wanting to follow up with each other. That's fantastic. As said, we will circulate to you all, we'll distribute to you all copies of the presentation